When a couple are experiencing fertility problems, that can impact on sexual function as well, particularly for the male. Not only does he usually have to have sex on demand, in other words, at the right time of the month, you must have sex now. He does feel a lot of pressure and of course anxiety, particularly if they're unsuccessful that particular month, and it can reflect in sexual function. For example, they may not be able to have an ejaculation. They may not be able to withhold the erection long enough to be able to have an ejaculation, and one will realize that ejaculation within the vagina is very important if we're talking about pregnancy. In this situation, just over the period of fertility treatment, it's often wise to see the couple, perhaps have an in-depth discussion and try and work out what the anxieties are. But often we would give patients simple medications such as sildenafil or Cialis, just to improve erectile quality for them to be able to finish a sexual attempt. There are the other situations, of course, is where there is sexual problems which is causing infertility. So, for example, patients that have severe premature ejaculation, in other words, they're ejaculating before they penetrate their partner. Now, one would realize that this is quite a serious problem from a fertility issue. We can treat this with medication. They can treat this with counseling. Or of course you can treat it in the laboratory. So if you wished, you could just produce a sample and then inseminate it into their partner in an intrauterine fashion. So there are ways around all of this, and sometimes the fertility issues, particularly if it's the first child and the pressure is to actually have a child, perhaps from the parents and the family, the pressure's on. And sometimes these couple need help from a sexual point of view. The other problem is sometimes patients are unable to ejaculate for whatever reason. So they're having sex and they feel they're unable to climax within their partner. Sometimes they have secondary problems that we can deal with by them producing a sample in the laboratory, and again using that, because some patients are able to have a climax on their own but not within their partner. So this is another sexual problem that we would encounter. One, I guess, very common problem that we see in the IVF units is the patients not being able to produce a sample. So the eggs have been collected and the partner's been told go and produce a sample, and the anxiety, the situation, it's just impossible, and they're there for hours trying to produce a sample. We would give them medication. We would give them sildenafil so that they can withhold the erection for longer. We can give them a drug called yohimbine to try and make them have a climax and produce the sample. Or occasionally, as surgeons, we're called in because the eggs have been collected and we have to do a sperm retrieval on the patient via various methods. But in general, sexual problems is usually erectile dysfunction, but don't forget that there are ejaculation problems which have treatment, very good treatments these days. And so if you are having problems sexually, then of course go and see your doctor and he will treat you and refer if necessary.